Today we're going to discuss about empathy and communication in patient care. Uh, we just don't diagnose and treat illness. We connect with people in their most vulnerable moments, and the way we communicate can impact patients' perception, trust, and understanding of overall how they are or how they're doing, overall well-being. So let's take an example of a patient. Let's say Sarah. She's a 35-year-old female. She's experiencing chronic pain. Now she has gone to multiple doctors and feels unheard and dismissed. Today she's coming for an appointment with you, and let's explore empathy and communication can transform her experience. Now let's talk about the internal themes which take place within her uh, and how empathy is perceived. So, building the trust and connection. So, as Sarah comes into the room, she looks tired and frustrated, and she hesitates before speaking as she's expecting another doctor who's dismissing her. And this is where the internal themes of her empathy come into play. Now, she comes in. Let's talk about the first, like these are all the internal themes. Let's talk about the first one, which is emotional sharing. Now, instead of like as she comes into the room, instead of jumping into straight into medical questions, you acknowledge her emotions. You say something on the lines of, Sarah, I see that this has been really difficult for you. Chronic pain can be exhausting both physically and emotionally. I want to understand what you're going through so we can find a solution together. By doing this, you're validating her experience and letting her know that she's not alone. So that is, she's able to share, like you're saying something which puts her at ease, puts her in a place where she thinks that you value her thought process and her view of the situation, and you're validating also her experience. Now let's jump on to positive relationships. In positive relationships, you are maintaining eye contact. She knows that you're focusing on her, and she starts opening up. Now this builds a positive relationship. You're not just about symptoms, but you're about the person, and she can see it. That builds a positive relationship. Now then comes mutual regard. Now when you think about mutual regards, like Sarah, let's say Sarah tells you something. Doctors have told me that it's all in my head. The pain is in her head. Rather than dismissing her concerns, you say, I believe you. Your pain is real, and we are going to work together to find a cause. By respecting her perspective, you create a space where she feels safe and share more. So that's mutual regard. Now let's go to personal genuineness. That is being authentic and you choose to be honest. I can't, you can say that I can't promise that your pain will completely disappear, but I can promise that we will do everything we can to improve your quality of life. We will explore different treatments and adjust them as needed. So here it shows that you're really trying and you're honest about it. Okay, and it strengthens the trust. Okay. Now, external themes related to the patient. Now that Sarah feels heard and supported, she starts engaging more in the conversation. But what helps her connect even more are things which are similarity. That is, Sarah mentions that she used to be an athlete and but had to quit due to pain. If you relate some way to that context, you can say, I used to run in college and I understand how difficult it is when body doesn't cooperate. Let's find a way to help you stay active in a way that you feel right for you. So there is a similarity in that context. She was an athlete, you used to run. You kind of connect the thing and say that let's try to see what we can do for it. Okay. Now, relevance. Relevance means You explain how lifestyle changes might help plain instead of just listing it as a recommendation. So, for example, you can say something like, I know you love being active. If we can reduce the inflammation in your joints, you might be able to return to the same activities you miss. So let's work towards that goal together. So what you're doing is that you're creating relevance and not just listing. Like a recommendation is given practically how that can play and how that can be implemented, that you're showing. Okay. Now availability. Now Sarah says that, what if I have questions later? How do I communicate? You can say you can always message me through patient portal. We will schedule follow-ups to adjust your treatment plan as needed. Okay. Now, now the process of all this can happen with communication, which is empathetic and open-ended. So let's talk about open-ended questions. So you can ask something like, does the pain feel better? That is limiting her response. So it's a closed-ended question. Instead, you can use that as, can you describe how your pain feels throughout the day? That is more open-ended, which gives her an opportunity to express more. Now, empathetic responses, here you're acknowledging emotions and showing understanding. Like, let's say that Sarah expresses frustration of failed treatments. You can say something like, that sounds incredibly frustrating. I can only imagine how hard this has been for you. Let's make sure you don't have to go through this alone anymore. So the way you phrase that, it shows that it is an empathetic response. Now, closed-ended questions are rarely used in this kind of things. You want to use when sometimes in suicidality or something for specific information. But the whole goal is um, you are understanding what are the internal themes and what are the external themes, and how you're going to use this um, way of asking questions or way of engaging to build that trustful relationship. So I recommend watching this video twice if you like it, because I know that I'm using a lot of examples, and it will be helpful to hear it out. Okay, thank you.